What if I told you there is a four-movement back routine developed in tactical fitness circles used by elite military operators, including Navy SEALs, to remain pain-free under extreme physical stress, and now widely prescribed by physical therapists for adults over 60 dealing with chronic lower back pain? It does not require a gym. It does not require equipment. It can be done in 10 minutes a day on your living room floor, and it may be the single most effective lower back routine ever developed for ordinary adults trying to live and move without pain. Here is why this matters. Navy SEAL operators are some of the most physically demanding athletes on Earth. They carry heavy gear for hours, they sleep in awkward positions, they lift, drag, push, and pull under conditions that would destroy the average back. And yet, the strongest, longest-serving operators tend to remain functional and pain-free for decades, well into their 50s and beyond. How? Because they follow a specific, scientifically validated back routine, originally developed and refined by spine researcher Dr. Stuart McGill of the University of Waterloo. Dr. McGill spent his career studying lower back pain. His methods have been adopted by military operators, elite athletes, and physical therapists worldwide. And here is the beautiful part. The same routine that keeps a SEAL operator functional under load is exactly the routine that can save an adult over 60 from chronic, debilitating back pain. In this video, I am going to walk you through all four of these movements. I will show you exactly how to do each one. I will explain why they work, and I will give you the daily protocol that has helped countless people, both elite operators and ordinary adults over 60, stay out of pain and out of the doctor's office. Stick around till move number 1, because that is the cornerstone movement, the one that creates the foundation for everything else, and the one that physical therapists call the most undervalued back exercise ever developed. Before we get started, drop your name and where you're watching from in the comments. We'd love to hear from you. Move number 4, the pelvic tilt, the foundational warm-up that wakes up your deep core and prepares your back for everything else. This is the move that most people skip. They think it is too simple, too gentle, too obvious, and in skipping it, they miss the most important preparation their back can receive. Here is how to do it. Lie flat on your back on the floor or a yoga mat. Bend your knees so your feet are flat on the floor, hip-width apart. Arms rest at your sides. Now gently tilt your pelvis so that your lower back presses into the floor. There should be no space between your lumbar spine and the mat. Hold this position for 5 seconds. Then slowly release. Practice 10 to 15 repetitions, slowly. Here is why this is so important. Most adults over 60 have a quiet disconnect between their brain and their deep core muscles. After years of sitting and minimal movement, the transverse abdominis, the multifidus, and the pelvic floor have essentially gone to sleep. They no longer fire automatically. They no longer protect the spine. The pelvic tilt is the gentlest, simplest, most reliable way to wake these muscles up. It teaches your brain to find them again. It teaches your spine what neutral position feels like. It teaches your nervous system how to engage your deep core without using the surface muscles that often dominate. In military rehabilitation programs, this is always the first movement taught, before any heavier work, before any plank, before any other core exercise. The pelvic tilt is the foundation. For adults over 60, this single movement, done daily, can begin to restore years of lost core function. It is also one of the safest back exercises ever developed. Almost anyone can do it. This isn't just a warm-up. This is the conversation between your brain and your back restored. Move number 3, the McGill Curl-Up. The spine-safe core exercise that builds deep abdominal strength without endangering your back. Forget everything you know about sit-ups and crunches. Those traditional exercises, while popular for decades, have been shown by spine research to actually contribute to lower back damage in many people. They force the spine into repeated flexion under load, which over time can damage discs and aggravate existing back issues. Dr. McGill developed the curl-up specifically to build strong abdominal muscles while protecting the spine. Here is how to do it. Lie flat on your back. Bend one knee so that foot is flat on the floor. Keep the other leg straight. Place your hands palm down underneath the natural curve of your lower back. This is critical. The hands maintain the neutral arch of your lumbar spine throughout the movement. Now, slowly lift only your head and shoulders an inch or two off the floor, just enough to engage your abdominal muscles. Your lower back stays pressed firmly against your hands. No movement in the lumbar spine at all. Hold for 5 to 10 seconds. Lower slowly. Practice 5 to 8 repetitions. Then switch legs and repeat with the other knee bent. Here is why this exercise is so brilliant. Traditional crunches load the spine while bending it. The McGill Curl-Up loads the abdominal muscles while keeping the spine in its safest, most neutral position. You build maximum strength in the deep core with zero risk to the discs. For military operators carrying heavy gear, this matters because it builds the anti-flexion strength needed to support the spine under load. For adults over 60, this matters because it builds core strength without the risks of traditional ab exercises. This isn't just a sit-up alternative. This is the smartest abdominal exercise ever developed for adults with backs that need to last. Move number 2, the modified side plank, the lateral stability builder that protects your spine from the most common forms of injury. Most lower back injuries do not happen during heavy lifting. They happen during simple sideways movements. Reaching for something off to one side, twisting to grab a seatbelt, lifting a grocery bag with one hand. The spine is most vulnerable when it is loaded laterally, in directions it is not strong in. The side plank is the antidote. Here is how to do it. Lie on your right side on the floor. Bend your right knee so it forms a 90-degree angle, with your right shin behind you. Your right forearm rests on the floor directly under your right shoulder. Your top leg, the left leg, stays straight, with your left foot stacked above or just in front of your right knee. Now, lift your hips up off the floor, creating a straight line from your shoulder down to your right knee. Hold this position for 10 to 30 seconds. Slowly lower. Switch sides. Practice 2 to 3 holds per side. This modified version, with the bottom knee on the floor, is significantly easier and safer than the full side plank, while delivering nearly the same benefits to the deep lateral core. Here is why this matters. The side plank activates the quadratus lumborum, the obliques, and the deep gluteal muscles, all of which are critical for protecting your spine during everyday twisting and reaching movements. These are also the muscles that decline first with age and sedentary living. Military operators rely on this exercise because it builds the lateral stability needed to carry heavy gear asymmetrically, often with weight slung over one shoulder, often while moving over uneven terrain. The same stability protects an adult over 60 from the everyday sideways movements that can suddenly trigger a back episode. This isn't just a core exercise. This is lateral spine insurance, day in and day out. Move number 1, the bird dog. The cornerstone movement that puts every other piece of this routine together. This is the move that physical therapists, military fitness coaches, and back specialists worldwide agree on. The single most important back protecting movement ever developed. The one that builds the kind of total spinal stability that prevents injury, eases pain, and restores confident movement. Here is how to do it. Get on your hands and knees. Hands directly under your shoulders, knees directly under your hips. Your back should be flat, neither arched nor rounded. Now, slowly extend your right arm forward, while at the same time extending your left leg straight back. Both reach until they are parallel to the floor. Your spine stays absolutely flat throughout. Hold for 3 to 5 seconds. Slowly return to start. Then switch sides. Practice 6 to 10 repetitions per side, slowly and with full control. Here is why this is the king of back movements. The bird dog trains every aspect of spinal stability. Your deep core, your lateral core, your gluteal muscles, your shoulder stabilizers, your hip stabilizers, the muscles along your spine, the connection between your brain and your body. All firing together to keep your spine perfectly neutral while 2 limbs move independently. This is exactly the kind of stability that real life demands. Reaching for something on a high shelf while standing on one leg, twisting to grab a seatbelt with one hand, lifting a grandchild while balancing on one foot. Dr. McGill has called the bird dog one of the most important exercises he has ever studied for lower back health, especially in adults over 50. Military operators use this exercise as part of their pre-deployment and post-deployment back maintenance. Physical therapists prescribe it to patients recovering from back surgery and chronic back pain. For adults over 60, this is the movement that brings every other piece together. Without strong, integrated spinal stability, the other movements give partial benefits. With it, your back becomes a unified, resilient, protected system. This isn't just an exercise. This is the foundation of a back that lasts. Now let me give you the exact daily protocol. Perform all 4 movements in this order, every single day. First, the pelvic tilt, 10 to 15 slow repetitions, about 2 minutes. Second, the McGill Curl-Up, 5 to 8 repetitions per side, about 3 minutes. Third, the modified side plank, 2 to 3 holds of 10 to 30 seconds per side, about 3 minutes. Fourth, the bird dog, 6 to 10 repetitions per side, about 4 minutes. Total time, about 10 to 12 minutes a day. Practice in the morning or evening. Use a yoga mat. Wear comfortable clothing. Move slowly. Focus on quality, not speed. Who should avoid? If you have recent back surgery, an active disc problem, or any acute back injury, please consult your doctor or physical therapist before starting this routine. Always begin gently. Pain is not progress. Listen to your body. So there it is, the 4-movement back routine, developed by spine research, validated by military operators, trusted by physical therapists, and available to any adult over 60 who is ready to take back control of their back. You do not need to be a Navy SEAL. You do not need to be young. You do not need to be strong. You just need 10 to 12 minutes a day, a small piece of floor, and the willingness to give your back the daily attention it deserves. The pelvic tilt to wake up your core, the McGill Curl-Up to build safe abdominal strength, the modified side plank to protect against lateral injury, the bird dog to integrate everything together into one resilient, stable, capable spinal system. Within weeks, you will likely feel a difference. Less morning stiffness, less afternoon ache, more confidence when you reach, lift, twist, or move, and the slow, steady disappearance of the kind of background back tension so many adults over 60 have learned to live with. So tell me in the comments, how long have you been dealing with back pain or stiffness? Which of these 4 movements do you think will challenge you most? Drop your thoughts below. I read every single comment. And if this video helped you, please hit that like button and subscribe to Sharp 50. Every week I share